Graduating with her master's degree in audiology from the University of Southampton in England, Marilyn has worked in a variety of settings within clinical audiology, always with an interest in geriatrics. Throughout her career, Marilyn has served as Vice President of the College of Audiologists and Speech-Language Pathologists, Counselor of the College for 6 years, and is currently a member of the Audiology Practice Advisory Committee. She also finds time to volunteer with Canadian International Hearing Services and is on the board of directors of New Leaf Living and Learning, a residential program for dual-diagnosed developmentally disabled adults. Marilyn is here this afternoon to talk about the nature, symptoms, and causes of age-related hearing loss and its impact upon everyday communications. We're very pleased to welcome Marilyn, and away you go.
Thank you so much. Well, thank you for having me. Can everyone hear me? Please tell me if you're not able to hear me throughout the presentation. So, if you answer yes to any of these questions, do you find that you can hear people talking, but you can't make out what they're saying? You can't understand the words? Do you find that people speak too quickly? That's one of my problems, so slow me down if you need to. Do you find that you often have to ask people to repeat what they said? Do you have trouble hearing when you can't see the speaker's face? And do you find you can hear better with your glasses on? Now be honest, how many people can hear better with their glasses on? I can, yeah. And that, of course, is so that you can see the person's face and get the visual information and lip read. And do you ever find that people tell you that your TV's turned up too loud? Right, so there were a lot of nods to all of those questions. And you may feel that your hearing is just fine and it's everybody else that has a problem. But certainly that last question, do people tell you that you turn the TV up too loud, is a real teller, because you think, especially if you live alone, you think, oh, TV's just normal, you know, and you've got it all the way up and your neighbors are banging on the walls because you're keeping them awake at night. So if you answered yes to more than one of these questions, you probably do have a problem with your hearing. And if you find yourself having conversations like these, then it might be time to do something about it. Well, first of all, hearing loss is incredibly common among seniors. It's actually one of the most prevalent health conditions among seniors, and it's the third most common disability, chronic disability, in North America after arthritis and hypertension. The prevalence increases with age, so the older you are, the more likely you are to have hearing problems. And about 30 to 40% of people over the age of 65, and even more, about 50% of people over the age of 70, have a problem with their hearing. And when we look at people living in long-term care and nursing homes, about 80 to 90% of people have hearing loss. So it's very, very common. And I thought it would be helpful for you to know a little bit about the causes of hearing loss and about the hearing mechanism in general, so that you can understand the nature of age-related hearing loss and how it affects our daily lives. Well, the ear and the whole hearing mechanism is a remarkably complex mechanism. And really, it never ceases to amaze me how complicated it is and how it ever evolved like this. And we're still learning things about how we hear. We learn things all the time about how the ear works. But just for today, I'm basically going to divide it up into the outer, the middle, and the inner ear. And I think I have a button here somewhere that has a... never mind. The red one, sorry. Oh, okay. So we've got the outer ear, the middle ear, and the inner ear. Three basic parts of the ear. And basically what happens is that sound, when I'm talking to you now, for example, I'm causing the molecules in the air to vibrate. And those vibrations get collected by this part of our ear, which is why we hear better when we do this, and direct them down the ear canal to the eardrum. And then those little vibrations cause the eardrum to vibrate. And then we get to the middle ear, which is an amazing area where these three little bones, the tiniest bones in the body, also vibrate, but those little bones amplify the vibration so that by the time they get into the inner ear, they're big enough to actually cause fluid in this organ here, the cochlea, which looks like a snail shell. They're big enough to cause the fluid in that organ to vibrate as well. And then that sets off some tiny little nerve endings that are in the cochlea. It sets off an electrical impulse that's carried along the hearing nerve to the brain where those vibrations are interpreted as sound. So it's an incredibly complicated mechanism. And if this works, I've just got a short YouTube video to show you, which just very nicely shows how this happens.
Ears are constantly active. They pick up sound waves and change them into information that the brain can interpret, such as music or speech. Sound is a pressure wave that can vibrate either quickly or slowly. Slow vibrations produce deep sounds, while quick vibrations produce high-pitched sounds. Sound enters the ear and is directed through the ear canal, where it first reaches the eardrum. As the eardrum begins to vibrate, it sets the ossicular chain in motion. The ossicular chain consists of the hammer, anvil, and the stirrup. Sound vibrations move along the ossicular chain and into the inner ear. Within the inner ear, the cochlea plays a central role. It is here that the mechanical energy of sound is converted into complex electrical signals, which are then passed on to the brain. In simplified terms, the cochlea is a spiral-shaped tube filled with fluid. Sensory cells, also called hair cells, line the entire length of the cochlea. These hair cells have varying degrees of sensitivity for the detection of different tones or frequencies. This allows the ear to perceive the entire spectrum of sound. The change from mechanical vibration to electrical pulse is a complex process resulting from the movement of hair cells in the cochlea. Along the entire length of the cochlea, the hair cells are arranged like the keys of a piano. Hair cells located at the base or lower region of the cochlea are responsible for high frequency, while hair cells at the apex are responsible for the low frequencies. As the fluid in the cochlea is set in motion, it causes a corresponding movement of the fine structures on the surface of the hair cells to take place. These movements cause tension differences, which produce electrical signals that are passed along the hearing nerve to the brain. The auditory cortex of the brain interprets this information as sound, for example, as music or speech. The entire chain of events, including the various steps that convert sound waves from the environment into information that the brain can interpret, happens so fast that individuals can hear sound both continuously and instantaneously. Within this complex chain of events, there are a number of factors which can cause an individual to experience hearing loss. A loss of hearing can range from a mild to moderate hearing deficiency to a total hearing loss. In general, there are three main types of hearing loss which differ from one another depending on the part of the ear that is affected, be it the outer, middle, or inner ear.
Okay, so you can imagine with, now how do I get back? I just escaped, I think. No, not sure, sorry. Oh, there we go, good, excellent. So you can imagine then, with that incredibly complicated system, as they said, anything can go wrong at anywhere, any point in the pathway. So just let's talk about some of the most common causes of hearing loss. What can go wrong in the outer ear, where the ear canal is? Any ideas? Yeah, a really common cause is wax. And probably, let me just see how many of you actually clean your own ears. You have to be honest. Okay. And how many of you heard the saying that you shouldn't put anything smaller than your elbow in your ear? Right, right. So you should pay attention to that last one because it's true. The problem with cleaning our own ears, it feels really good, but it's really bad for us because what we're actually doing, if there is wax there, we're actually pushing it down further, especially if you're using something like a Q-tip. Because Q-tips are big enough to actually, push the wax down. They're not really small enough to get it out. And in any case, it's very difficult to get wax out of your own ear canal. So I would strongly advise you to go to your doctor. And I don't know if you find that your doctor routinely looks in your ears or routinely offers to clean your ears. Sadly, a lot of family doctors don't seem to do that anymore, but I think I would strongly encourage you the next time you go for a general medical to ask your doctor to look in your ears. And if there's wax there, hopefully they'll remove it for you. I know a lot of them nowadays will refer you to an ear, nose and throat specialist to have that done, but some doctors will do it in their offices. And so just encourage them to take a look in your ears because it's quite remarkable how a real plug of wax can impact your hearing. As long as there's still enough of space, like even a pinhole for sound to get through, it will. But one day you'll have a shower and that water will make the wax expand and you'll feel like you've gone completely deaf. So it's a good idea to get that wax removed on a regular basis if you're prone to having a lot of wax. And I seem to find that seniors, as we get older, we tend to produce even more wax, especially if we wear hearing aids. Because when we're constantly putting a hearing aid in our ear, every day we put that in, we're pushing the wax in with the hearing aid. So you tend to find wax accumulating if you're using hearing aids or earplugs regularly. So it's another good reason to get them checked out. Middle ear, a very common cause of problems in the middle ear where those three little bones are, is infection. Now, we tend to get infections a lot more when we're young than we do when we're old. Little kids get infections a lot because the eustachian tube, which is the little tube that connects the ear to the throat, is very short and straight in little kids, so it's very easier for bacteria from the nose and the throat to travel up into the ear. But as we get older, that tube gets longer and has a bend in it, so it's not quite so easy for bacteria to travel. But nowadays, we do have antibiotics, and so ear infections are normally treated pretty easily, whereas when a lot of seniors that I see at Baycrest who tend to be well in their 80s, 90s, and some of them 100, they remember the days before antibiotics when ear infections were a really serious thing because they could untreated, they can actually go into the mastoid bone at the back of the ear, and then you hear about people having mastoid surgery. Fortunately, that's in North America, that's pretty much a thing of the past. But it is one of the reasons why we have to be so careful with our use of antibiotics, because kids nowadays, they get ear infections and antibiotics are just prescribed just like that. And we're becoming resistant to those antibiotics already, so we have to be careful with that. Another problem, let's have a look at the inner ear. The inner ear is where that spiral snail-shaped structure, the cochlea, is, and that's where the little nerve cells are, and that's where things can really go wrong. And that's where most of the permanent hearing loss causes occur. What do you think is the most common cause of inner ear hearing loss? Can you hazard a guess? Common cause?
Loud music.
Very good. Noise in general, not just loud music, but funnily enough, when a lot of you were young, a lot of the noise damage happened at work. Or for people that served in the armed services during the war, they'd have a lot of noise exposure. Or if they worked in noisy factories, they'd have a lot of noise exposure. And so when we realized just how damaging this was, we developed legislation to protect people at work so that if you work in a noisy factory, you can only be exposed to a maximum of 85 decibels for a regular working day of about 8 hours. And the louder the noise is, the shorter the time you can be exposed to it. Ironically, once we got people protected at work, they started going home and damaging their hearing at home by listening to loud music and using things like leaf blowers and power tools and all kinds of things that can damage our hearing. And of course, we can't stop people doing that when they're at home. So there's certainly a concern now because so many kids are constantly listening to music on their iPods and various different devices. So there's a push now to educate children about not listening to music that's too loud for too long, because once that permanent damage is caused in the inner ear, we don't yet have the ability to fix that. And the other, what do you think the other right up there cause of hearing loss in the inner ear might be? Aging. And until recently, aging was the #1 cause, but now because of so many people damaging their hearing with noise again, they're pretty much neck and neck at the moment. So really, when we talk about age-related hearing loss, we're talking about an umbrella term of all the things that have happened to you throughout your life. Maybe you have some genetic factors that predispose you to hearing loss as you age. If your parents or you have people in your family that were hard of hearing, then maybe that's one of the factors. Or your exposure to noise, your exposure to ototoxic drugs, things like chemotherapy can be damaging to your hearing, things like high doses of aspirin. There's all kinds of drugs that can damage your hearing. There's lots of things that can cause hearing loss, but certainly age-related hearing loss is right up there. Well, how do we know what the problem is and where it is in the auditory system? The best thing to do is to get a hearing test. Go and see an audiologist, someone like me who's trained to assess hearing and help you manage hearing loss. How many of you have had a hearing test? Oh, quite a lot of you. Okay, good, that's great. So you know what I'm talking about when I show this next slide. It looks like a bit of a busy slide, but what it is, this is an audiogram or a graph of people's hearing loss. And what we do, we measure, those of you that have had this done will remember, you hear a lot of little tones and they get softer and softer, and we ask you to let us know every time you hear a sound. And we measure the softest sounds you can hear at different frequencies or pitches. So down the side here we have the loudness, and along here we have the frequency or pitch, with the low frequency bass tones on the left-hand side. And like a piano keyboard, you've got the high frequency, high pitched tones on the right-hand side. And this blue shaded area in the middle is what we call the speech banana. And that represents human speech. So human speech is usually delivered at around 50 to 60 decibels. And it's made up of all these different parts of sounds. So when I'm talking, my voice contains bass tones and high frequency tones, and these are the sounds like the b, d, and the voiced vowels. And then in the high frequencies you've got things like f, f, sh, things that are difficult to hear because they're very high pitched and they don't have voice behind them. So let's take a typical hearing loss of an older person, a senior, and the red symbols are the right ear and the blue symbols are the left ear. And this person, because they're high up the chart, I should back up by saying that a young person hears along the 0 line. So you'd see those blue and red symbols along the 0 line for a young person. An older person often hears quite well for the bass tones, but the sensitivity decreases as the pitch gets higher. So by the time you get up to those f, sh, k sounds, you're not hearing them. But you are hearing the vowel sounds in the middle. So when I talk, you will hear parts of the words, but you'll miss parts of the words. Hence, I can hear you talking, but I can't make out the words because you're only getting parts of the words. So how can you make out sounds that you're not hearing? As a result, you do a lot of guessing, filling in the gaps. And if you can see my face and your vision is good, you'd be amazed at how much information you get from speech reading. If you don't have your glasses on, and if I cover my face so you can't hear what I'm saying, and I say two similar words like cap, cat, cab, you might have trouble knowing which word I said. I said 3 different words there with different endings. But it's very easy when you watch my lips. If I say cab, cat, then you can see the difference. So I'm trying to just help to explain here why you're hearing parts of words and you're missing other parts. Now, it's not just our sensitivity for loud sounds that changes as we get older. You saw that video. There's a lot that goes on after the ear, the outer ear. There's a lot that goes on, the middle ear, the inner ear, and then the sound has to get carried from the inner ear along the hearing nerve up to the brain. And that's only the beginning of how the brain processes that sound once we actually detect it. And research shows that our brains, as well as our ears, become hard of hearing as we age. And what I mean by that is that there is processing of sound in the brainstem. We call it the central auditory system. Here, central auditory system changes. And those are things that happen after the ear, on the way to the brain. As we age, so many things happen to our brain and our nerves that those signals may not get carried clearly to the brain. They get distorted, they get jumbled up. The other thing that happens as we age is that everything slows down. Our speed of processing slows down. So we just can't keep up with those fast talkers that speak really quickly. We need more time to process the sound. And we have difficulty with localization because in order to tell where things are coming from, we have to get input from both ears delivered to the brain. And that information from the two ears gets crossed over and communicated on the way to the brain. So if there's a problem with that area, then the information from the two ears is not going to get integrated in a way that the brain can use it to tell where things are coming from. So that can be a problem too. And then, even higher up in the brain, we have what we call cognitive changes, where we actually have problems processing the information that the brain receives. So for example, as we age, we start to have problems with memory. And we start to have problems with focusing our attention. Because one of the things that happens with aging is that we become less able to focus on one person talking and ignoring the background noise. So, do any of you have trouble hearing in background noise? Yeah, I do. I'm 60 now and I certainly have a problem hearing when there's a lot of other people talking around me, like at a noisy party or a restaurant, especially if there's music added to the mix. So, as we get older, we have difficulty focusing and filtering out, and that's a brain thing, that's a cognition thing, that's not a hearing thing. In fact, people with good hearing, if they're older, can have problems that I've just described, hearing in noise and hearing fast talkers, even if their hearing is good, because their brain processing has changed, or is changing. So what does all this mean in terms of our speech understanding? Well, the loss of those high-frequency consonant sounds means that people say words are not clear, they can hear people talking, but it sounds like everybody's mumbling. And that's because you're missing those high-frequency consonants that tend to form the beginnings and ends of words. So you're just getting the middles of words. So it sounds like people are swallowing their speech. And then those auditory processing changes that I was talking about mean that you have trouble hearing speech in noise, you have trouble hearing fast speech. So some of my patients tell people, I can't hear you that fast, which is a very good thing to remember because that's probably the most helpful thing anybody can do for you with age-related hearing loss is speak slowly. What does all of this mean in terms of impact on our daily lives? Well, it can have a huge effect because hearing affects everything that we do. Can you give me 2 or 3 things that we use our hearing for? What do we use our hearing for? Yeah, conversation. Mostly it's communication, isn't it? We have to keep in touch with people with our ears. And I think Helen Keller, who was blind and deaf, said that you need to be able to see to know what's going to see, to be in touch with the environment, but you need to be able to hear to be in touch with your fellow humans. And as humans, we communicate with speech and language. So if we can't hear, then it has a huge impact on our ability to communicate with other people. What else do we use our hearing for? There are some other things.
Waking up in the morning.
Yes, yes. I heard somebody say entertainment and music, and yes, music is hugely important. How many of you would just hate it if you couldn't hear your music, if you couldn't listen to music? Right, it's important to a lot of us. So it's not just music, it's things like a lot of us get our entertainment from watching TV, listening to music, listening to the radio, going to movies, going to the theater, and so on. And there's one more thing that's very important. Yes, safety. That's, you know, if you can't hear, you don't really know what's going on around you. You feel kind of uncomfortable because you're not sure what's happening. You can't hear if somebody's at the door, you can't hear the phone ring, and so on. So that can be quite an issue. And I know, just an example from my family, my mother-in-law's hearing got worse and worse and worse, and she was living on her own. And I tested her hearing, terrible patient, wouldn't do anything I said. Said, no, my hearing's fine. And so as a result, we would often be trying to phone her, and she wouldn't answer the phone. So we'd be driving over there to see what was up, expecting the worst, and finding her sitting happily watching TV with it turned up to about 100 decibels, and she couldn't hear the phone. So eventually we began to worry because she couldn't hear the phone. She didn't know if people were trying to reach her. She couldn't hear the door, so obviously that became a concern. And in fact, it is a lot of, it's a real concern for families. If they can't reach you, and you probably know loved ones that you have trouble reaching on the phone if they have a really bad hearing problem. So it is one of the reasons for people not being able to live alone independently. So it's a very important thing to be able to function independently and live alone safely. Now I just want to, so it has a huge impact on many of the things that we do in daily life. Socialization, the ability to participate in healthcare. Do any of you like to take somebody with you when you go to the doctor because you're afraid that you might miss some of the things that the doctor's telling you? Things like, it's very important for your emotional well-being and your general quality of life. Socialization is very important, and if we can't go out with friends and communicate on the phone, it can have a big impact on our quality of life and certainly reduce our independence. Now I just want to talk a little bit more about hearing and cognition, because you're probably realizing that I'm giving you all kinds of reasons why you should do something about it if you think you have a hearing problem, or if you have friends or family that have a hearing problem. It's important for you to encourage them to do something about it for all the reasons I'm saying today. And this is a very interesting area for me because I've always worked with seniors and I've always been interested in the link between hearing loss and people's cognitive ability, their memory and so on. And I'm very lucky now because I work at Baycrest where a lot of research goes on in this area. And it's a very, very interesting time for us in audiology, those of us that work with seniors. Because over the last couple of years, there have been some very large studies that have been published out of places like Johns Hopkins in the States, where they've been following people as they age, and they measure everything. They measure blood pressure, vision, hearing, everything. And then they look back over the years and see what kind of links they're looking at. And this kind of research has shown that there is a definite link between hearing loss and the likelihood that we're going to develop cognitive impairment as we age. And people are more likely to go on to develop dementia if they have untreated hearing loss. And the more severe the hearing loss, the greater the risk. And there's actually quite a close linear relationship between the degree of hearing loss and the likelihood to develop cognitive impairment. So that's very, very significant. And we don't understand exactly why. And that's the kind of research we're looking at now to try and find out what it is and if there's something that we can do, if we can treat people's hearing loss early on, does that mean that they're less likely to develop this cognitive decline? We don't know yet, but that's the kind of stuff we're looking at. We're just learning about this. But the people doing the research have some theories about what the cause might be. And one theory is that it might be shared pathological process. So it might be some disease process going on with aging that affects both the brain and the hearing mechanism. So it might be that the same thing is causing both problems. Or it might be cause and effect. how might the hearing loss actually be leading to some cognitive decline? Well, one theory is called the cognitive load theory, and it sounds complicated, but it really just means that all of us have a limited pot of cognitive resources in our brain for information processing. And if we have to make a real effort to hear people, then we have fewer resources left in our brain for making sense of what we hear and remembering what we hear. And studies actually show that that's true. The more we're having to make an effort to hear, if they do studies where people are trying to do two things at once and so on, or if there's noise in the background and it's harder to hear, you actually remember less. So also, if you are having to pay a lot of attention, you have to really focus on trying to make out what people are saying, it's tiring, isn't it? And so you're exhausted. So you go home and you probably don't remember very much of what you heard. Another thing is, if you're paying attention so much to what somebody's saying, you're not able to kind of monitor what else is going on. So we're even finding that people with hearing loss are more likely to have falls because they're paying so much attention to hearing that they're not monitoring what's going on and where they're going and where they're standing, and they're not able to monitor where they are in the environment as well. So if you, sorry, yes, there's a question at the back.
Is this cause and effect relationship, does this apply to children as well? Has testing research taken place that looks at the effects of hearing loss as far as cognition in children in addition to adults?
That's an excellent question. I'll repeat it. So Laura asked if this applies to children as well. And I think we don't know yet. I think that we're just seeing this link because of the epidemiological studies that are following aging and the aging process. So I couldn't really answer that question for you. My area is geriatrics, so I'm not as up on the research with pediatrics. But I think these things about cognitive resources would apply to children as well as adults. It's just that with adults, they're having a harder time because they have these other deficiencies that are occurring with aging, like, you know, your vision's going, your hearing's going, and your auditory processing is changing and your memory is getting worse. So it's this whole bunch of things together. So I think with children it would just be a very different picture. And so I wouldn't like to comment on that, but I'm sure that that's an area of research that's going to be coming up as well, for sure. So the other possible cause and effect thing, and I'm saying this is only a theory, this is just one of the theories, is that if you're not stimulating your brain, then that may lead to more cognitive decline. It's the kind of use it or lose it theory. We all know now that there are a lot of brain games on the market to keep our brain active, and certainly I think the same applies to our hearing, and some of those brain games do involve auditory stimuli. So some of them are visual, some of them are based on your hearing. But I think it's very important to keep your brain stimulated every way we can, and hearing is one of those ways. And the last but not least, which is very important, and this may be the leading theory, is social isolation. We now know that social isolation is a real cause for concern for seniors because it can lead to many, many health issues. It certainly can affect both mental and physical health and well-being, and it's now considered to be a key factor in healthy aging. And in fact, the Canada's National Seniors Council are focusing on this area for the next year, the upcoming year, and looking at the effects of social isolation and its prevention among the elderly, with the aim of trying to find ways to prevent and reduce the incidence of social isolation. And certainly we've known for a long time that there's an association between age-related hearing loss and social isolation, and that it's profoundly important to quality of life. It's kind of like a vicious spiral. If you don't hear, then you tend to kind of think, well, you know what, I'm not going to go to that lunch this time because I just don't hear part of them, and I just feel like I'm sitting there like a dummy because I'm not able to participate in the conversation. So the next time you get invited out with that group of people to that restaurant, you just say, I think I'll pass. And that happens more and more, and before you know it, you just start staying home more and doing less. And that's not a good thing, because then you become socially isolated, withdrawn, and then that can lead to depression, and depression is a known factor in cognitive impairment. So one thing can lead to another, and you just don't want to start on that downward spiral. A lot of times when people come to see me at Baycrest, it's because their family members have brought them, and I will say, well, what kind of things do you do? You know, what kinds of things do you need your hearing for? And they'll say, well, I don't go out, I just stay home. And you know, you've got to ask, why do they do that? Which came first? Was the staying home, do they not need a hearing aid because they don't go out, or do they not go out because they can't hear? So my advice would just be that if you are finding yourself modifying your lifestyle to suit your hearing loss, stop and think, I should be doing something about the hearing loss so that I can keep my lifestyle. So, having said that, what can you do? Well, most people would start by going off to their doctor because we want to make sure, as I said, that there's no wax or infection or anything like that you need to get looked at first. Then you hopefully your doctor would refer you to an audiologist, or you could just go straight to an audiologist if you want to, because we would look in your ears too. A lot of us are actually trained in wax removal because so many, well, certainly all of our audiologists at Baycrest are, because we see so many seniors that do have wax in their ears that we've become trained so that we can remove it ourselves rather than having to refer you to a doctor. Obviously, if the wax is deep and impacted, then we wouldn't try to remove that. We would refer you to a doctor, but a lot of it we can remove ourselves. And then we would do a hearing test, and then we would talk about your hearing loss and whether or not we think you can do something about it. And what could you do about it? Well, there are lots of different options. So for most of you, you might think that the only thing you can do about a hearing loss is get a hearing aid. And how many of you would have thought that coming here today? Yeah, most of you probably. And what we've been told, we've been talking to the doctors at Baycrest and saying, you know, we know about this link now between hearing and cognition, and we think it's really important that you send most of your patients to see us, because we want to find out if people coming into Baycrest, if inpatients and nursing home residents, we want to know if they have a hearing problem. And the doctors have said to us, well, that's great, we'd love to, but a lot of them, they say, well, what are they going to do for me? And they say, they're just going to give me a hearing aid, and I don't want a hearing aid, so I don't go. So we need to change that, because that is not the only thing we can do for you. There are other things we can do other than just hearing aids. So this slide shows you, we're going to kind of liken it to having a hip replacement. If you have a hip replacement, you probably, or if you, for a while, you might be in a wheelchair, you might need a walker just while you're recovering, just before you can walk independently. And that might be the technology that's equivalent to a hearing aid. Then you need the environmental modifications. You don't need just a wheelchair, you need a ramp. You can't go and get on the subway with a wheelchair unless the environment is accessible. So you need the environment to be accessible as well, things like ramps. And then you need the physical exercise. So it's not enough just to have the walker and the ramp, you need the physical exercise as well if you want to improve your physical disability. And we have exercises, we have hearing exercises as well, and behavioral communication strategies that we can suggest for you. So I'm going to go through these three categories now. First of all, technology. Well, hearing aids obviously are an important part of the technology. And hearing aids, I just love this quote because it really puts everything in it. It says, hearing aids help elderly people with hearing loss maintain two things that are of the utmost importance to them: their independence and the ability to stay connected with their communities. So why are so many seniors reluctant to get hearing aids? What do you think? Denial? Absolutely.
It's expensive.
Okay, good. Let me address those things. Any more? Yeah. Sorry, I didn't hear that. They always seem to fail.
It always seems.
That gentleman said they always seem to fail. A lot of people say that. They say they hear all these negative things from other people. Can I ask you, sir, do you have hearing aids or have you tried them? No? So where did you get that information from? From talking to other people? Okay. Because I've been an audiologist for 37 years, mostly with seniors. Do you think I'd still be doing it if I couldn't help anybody? No. I'm not saying hearing aids can fix all problems. I will never say that, but they can be a huge help. And my philosophy is, you can't know unless you try them, how much they can help you. Yes, Laura?
One thing that I hear is that when people compare getting a hearing aid to getting glasses,
Yep.
When they go to get glasses, it's rather precise, and they end up with glasses and they can see.
Right.
I'm told that with hearing aids, it's not quite like that. It's not as precise, and it's maybe that's why people say they.
Right. Did you hear what Laura said? No. Laura said she hears people say that with vision problems, they go and get glasses and they get fixed. With hearing problems, it's not quite that straightforward. They go and get hearing aids and they don't get fixed as easily. Okay. How many of you know people with macular degeneration? That's an age-related vision loss. Do glasses help people with macular degeneration? No. Age-related hearing loss is a bit like that. Sometimes it's very straightforward, it's just in the inner ear, and then when you make the sound loud enough with hearing aids, voila, you're fixed, or it helps a lot. But what if you've got these age-related changes higher up in the auditory processing? Doesn't matter how well the hearing aid works, the signal's going to get distorted afterwards on the way to the brain. With macular degeneration, doesn't matter how good the glasses are, they may make you see bigger, but you're not going to see any clearer because you just don't have what you need in your brain to interpret the information. So the problem is, just like glasses with macular degeneration, hearing aids will help hearing loss to varying degrees depending on where the damage is in the auditory system. Yes?
So can the audiologist determine where that is?
Yes, that was a very good question. This lady asked, can the audiologist determine where that is? And yes, we don't just do that test where we measure the softest sounds you can hear. We do a lot of tests with words as well. Now, you may not get every audiologist doing that. Some people in private practice might be more focused on hearing aids. If you go to a clinic where the audiologist is doing a full test battery, then yes, you will. At Baycrest, we do testing with words in quiet. We do testing with words in noise, with sentences in noise. We do testing where we're putting different information into the two ears at the same time to see how well your brain integrates that information. With all that testing, we can tell. Yeah, we can tell roughly whereabouts in the system it is. We can certainly tell how much benefit you're going to get from amplification, because we can tell by making it louder, are you then able to understand the words, or is it still all jumbled up?
And would the audiologist be able to determine if it just wouldn't help at all?
Would the audiologist determine if it wouldn't help at all?
Yeah.
Okay, let me give you my answer to that. If hearing aids can't make you hear words any better, would I still prescribe a hearing aid? Yes. Because even if you can't understand people talking, you will get information that will help you know where you are in the environment, know what's going on around you, make you feel more secure, and research shows that lip reading and hearing together are much more beneficial than either alone. So if you have some hearing, it will help to supplement your lip reading. Now, in a minute, I'm going to show you a slide that shows you a cochlear implant. Now, a cochlear implant is for people who are deaf, where a hearing aid cannot help them. No matter how expensive, how sophisticated the hearing aid is, it can't help you. It's like putting glasses on blind eyes. It's not going to help. So in that case, we have to give you an artificial inner ear. And that's what a cochlear implant is. It's doing surgery where you put an electrode into that little snail-shaped organ, the cochlea. You put an electrode in there, and then that electrode can detect the vibrations that that video is showing you and send them to the brain. Yes?
Do you offer lip reading classes?
Okay, I'm getting to that. Yeah, hang in there with me. This lady was asking if we offer lip reading classes. And we do offer classes. We don't do specifically lip reading for reasons I'll explain, but that's certainly part of the classes that we do, yes. So if you would hang on to that thought and we'll get there, okay? So these studies these statistics are interesting because they show that only 20% of older people who might benefit from hearing aids use them. So there is a huge bunch of people that don't do anything about their hearing loss. And research shows that most people wait about 10 years after being diagnosed with a hearing problem to actually do something about it. So there's lots of reasons why. And we talked about that. And the first one, we said, well, you might go to your doctor and he might find you do have a hearing loss and he might say, well, what do you expect at your age? You're 85, you know? Not a good thing to say. We expect a lot of things to change. Doesn't mean we don't get glasses, we don't get dentures. Hearing aids, same thing. Denial, big one. A lot of people deny that they have a hearing problem. Maybe they genuinely do think everybody else mumbles, or they don't realize how loud the TV is, but it is a big one, and we have to kind of explain. And a lot of times when families will bring their loved ones to see me, and they'll sit there and I'll say, you know, well, what kind of problems do you have? Oh, I really don't have any problems. My hearing's fine, you know, and the daughter's sitting in the background going, and so we have to bring the other person in, because if someone's in complete denial, we have to motivate them about what they can, you know, about the need to do something. So I will sometimes say, as a last resort, I will say, you know what? It sounds like you really don't have a problem hearing, but I think your daughter has a problem with the way you hear. Let's ask her, you know? And the daughter would say, Mom, you don't hear me on the phone, and your TV's really loud, and you're really out of it when we have family get-togethers, and, you know, so I will end up saying, okay, so don't do it for you, but do it for them. Because communication is always at least a two-way street. And if the other person's having a problem, then you both need to do something about it. You can show that you're making the effort by at least trying hearing aids or whatever else I'm going to talk about. But you need to make that effort so that your family sees that you're making that effort, and then they'll make more of an effort. Because with age-related hearing loss, it's not just about what you do in terms of a hearing aid, it's about what they do as your communication partner. You need them to change the way they speak to help you to hear them better. So it's both of you together have to make an effort on both ends. Stigma, big one. These are all big ones, I keep saying, I realize. But a lot of people still associate aging with hearing loss with aging, getting older, more than you do glasses and dentures. And so I always say, I was at a lecture recently with some young people at Humber College, and they didn't know what I meant by stigma with hearing loss, with hearing aids, because they all had something in their ears. They all were wearing iPods and, you know, these little communication things in their ears. And so they all have things in their ears. So it's a generational thing. Seniors today worry about people seeing things in their ears. That is not going to last much longer. Baby boomers, they're going to want everything in the hearing aid. They're going to, and it's going to happen. We're going to be connected with smartphones and hearing aids, and it's all going to happen very soon. Cost, somebody said cost. Yes, of course, they are expensive. A lot of people don't realize, though, that government does help you. So if you live in Ontario and you have an OHIP number, then you're also eligible for the Assistive Devices program to give you a grant of $500 towards a hearing aid. So if you have 2 hearing aids, you get a total of $1,000. Some people also have insurance plans that cover it, especially if you have a group plan. Like at Baycrest, we have a group plan. Teachers tend to have group plans, people like that. Usually they pay too. If you're a veteran, they will pay for everything, including your batteries. Workplace Safety and Insurance Board, same thing, they'll pay for everything. If you're eligible, if you really can't afford it, then you may be eligible through community and social services. So there are lots of ways that you can get help with your hearing aids. They are expensive though, and we'll get into cost in a minute. Low on the priority list. Maybe you have a lot of other health problems that are more pressing, you know, that hip replacement, knee replacement, whatever, may be more important. You may find that financially it's low on the list. You may be worried about, you know, you have to move into a retirement home or something, and so it can be quite a concern. But what do hearing aids do? As I said earlier, they don't restore normal hearing, especially they're not going to restore the hearing that you had when you were 21, so don't expect that. But they are meant to improve the ease of communication and minimize that listening fatigue that I was talking about. At least if you can hear people loud enough, you're going to find it easier to be able to follow what they're saying. Even if you don't get 100%, it's certainly going to be helpful. So carrying on with when you come to see me as an audiologist, and I've done the test, and I'm talking now about what we're going to do, and I say, well, you know, let's talk about hearing aids because you do have some hearing loss, and so let's see if we can improve by giving you some amplification. Then after that, we'd have another appointment where we'd sit and talk about hearing aids. This is called the hearing aid evaluation or prescription. And it's a very important appointment because we give you a lot of information. So usually I ask people to bring another person with them, a friend or a family member, so that they can help you make the decision sometimes and help remember all the information. First of all, I ask you what you need the hearing for. So are you still working? Are you a lawyer, a teacher? Are you still in very difficult listening environments? Maybe you're a doctor and you still have to be able to hear people when you're interviewing them. Are you retired and you want your hearing because you love to go to the theater and you love to be active on a volunteer basis and you still go to meetings and so on. So maybe you play bridge, and that's very important because you don't want to be able to miss any bids. So certainly that all of these things are important and they're all different. So I need to know when I'm thinking about what works best for you, what you need it for. I also need to know what your abilities are because I want you to be able to be independent if you're going to get a hearing aid. So I'm not going to recommend something tiny that you can't manage if you have stiff fingers, or maybe you've had a stroke and you can't even use one hand, or you have macular degeneration and you really can't see how to put that battery in. That can be a real barrier. We need to talk about whether you want to get 1 or 2 hearing aids and the reasons for that. We need to talk about hearing aid styles, and I'm going to show you some pictures and we can pass that around in a minute. We need to talk about the cost. There's a huge range of prices. I always say it's a bit like buying a car. You can either have your basic model that gets you from A to B, like my Toyota Corolla, or you can have something really fancy, you know, with the tinted glass and the really zippy engine and everything else. And that's going to cost you more, but you're probably going to be able to have more fun driving and get places faster if you need to. So basically you get what you pay for. There are different levels of sophistication with hearing aids. You can have what we call the entry level, or the mid-range level, or the very high end. And again, I would be guided by what you need it for. People say, well, if I spend $3,000 on a hearing aid instead of $1,000 on a hearing aid, what am I going to get for that $3,000? Well, you're going to get a hearing aid that works better in challenging listening environments. In a quiet environment, you'll be just fine with the $1,000 hearing aid. But the noisier it gets and the harder it gets, the better the more sophisticated technology will deal with those different signals and different challenging listening environments. Yes? Oh, completely in the canal. So I'll show you those in just 1 second. I think it's the next slide. And then there's all kinds of special options. So do you want, like in the car, do you want your tinted windows, your air conditioning? Well, these options can be very useful. We can have completely automatic or some manual controls. We can have special devices for the telephone. And I'm going to get to all this. So let me get to all this. These are the styles. So this one, maybe Laura, if you wouldn't mind handing that around, people can look at that as well as they're going. this is what we call completely in the canal. It's the smallest hearing aid, and it fits right in the ear canal so you can't see it. So some people like that because it's not very noticeable. However, I rarely prescribe them for my patients because I work with older people, and a lot of older people can't manage the tiny, tiny little batteries that go in those things, and they can't manage cleaning them well enough to keep them functioning. So obviously with a hearing aid that's tiny like that, you've got to have good vision and you've got to have good manual dexterity, or you've got to have somebody helping you with the hearing aid. And also, the smaller they are, the smaller the battery is. The smaller the battery is, the faster you'll use it up. So the little tiny batteries that fit in those hearing aids may last just a few days, whereas you can get 2 weeks or more out of a bigger battery. But batteries don't last long in hearing aids because hearing aids have a very high drain on batteries. So they use them up a lot more than something like a watch would, for example. Then we have the slightly larger in the canal style, which you can see a bit more and which is a little bit easier, and we can have a bigger battery in it. Then you have the full shell in the ears, still all in one piece and big enough to be able to see and manage the battery more easily. Then we have the behind the ear hearing aids. Now, when I started practicing all those years ago, that was pretty much what hearing aids were. And then over the years, they've become smaller and smaller and smaller. The problem with small like this is that these things completely plug the ear when you put them in. And a lot of people were rejecting hearing aids because they were saying, I don't like the way it makes me feel plugged up. We call it the occlusion effect. So over the last few years, hearing aid manufacturers have said, okay, then let's take the hearing aid out of the ear and put it behind the ear again, but let's make it smaller so it's not as noticeable, and we'll have just a little tiny tube or wire connecting it to the in-the-ear piece so that when you put these things on, you really don't see them, and you really don't see them. This is a man, and you can see he doesn't have much hair, and it's very small and very inconspicuous. And for somebody that still has pretty good hearing for those bass tones, this is a good solution because it's not blocking the ear canal, so you're feeling non-occluded, you're feeling more natural. It's using your natural low frequency hearing, but it's amplifying in those high frequencies where I showed you a lot of seniors mishearing. So this can be a really good solution for people who have mild to moderate hearing loss. If you've got really severe loss and you need a lot of amplification, this is not so good because you get some leakage of sound out of the ear. So we have to block the ear if we need to give you a lot of power. Otherwise, just like a plug in a sink full of water, it's going to leak. If we want to give you a lot of power, we have to plug your ear to keep the power, to keep the amplified sound in the ear canal. So we have to compromise. We have to think, well, do we want a hearing aid that looks good, or do we want a hearing aid that we can handle easily? Because these little thin tubes are a little bit trickier to manage and to put in the ear and keep in there. So you've got to have pretty good manual dexterity to be able to use those. Okay, so I've shown you what they look like on the outside. That does not impact the price. The price of the hearing aid is not determined by the size or what it looks like. It's determined by the tiny little computer chip inside it that I was talking about earlier, whether it's just a basic chip or whether it's a very sophisticated chip. All hearing aids now are digital, which means they all have that little computer chip inside them. And so what we do when we're fitting a hearing aid for you, all of the information we got in the hearing test, we program it into the hearing aid. The hearing aid then knows how loud you need the sound to be, how loud is comfortable, and how loud is uncomfortable. And we tell the hearing aid to keep all sounds within your comfort range. So if you're in a very quiet environment, the hearing aid will increase the volume. If you're in an environment like this, it will make sure my voice stays within your comfort range. If you go outside into the subway in a very noisy environment, it will reduce the amount it amplifies to compress the signal to keep it below that ceiling of discomfort. So modern hearing aids can do that. That's what they do. They can all do that. The harder thing is what happens when there's noise in the background. If the noise is traffic, you go out from here onto Yonge Street, a lot of hearing aids can tell the difference between traffic noise, which is like shh, steady state noise, and a voice like this, because my voice is constantly changing. It's a dynamic signal. So the hearing aid is looking for the steady noise, It knows it's noise, it knows you don't want to hear it, so it reduces it. If it finds a speech signal that's constantly changing, it will think, oh, he wants to hear that, so it'll amplify the speech. Hearing aids can tell the difference between noise like traffic and sound like speech. And with modern hearing aids, they're much better at detecting that feedback and cancelling it out so it doesn't happen. Okay, so these are the directional microphones I was talking about. Now, this is where modern technology is really improved in recent years. Anybody heard of Bluetooth? How many people have a cell phone? Okay, still not many people have a cell phone. Cell phones work on Bluetooth signal, and usually if you have, let me back up a bit, modern hearing aids, a lot of them are wireless. Certainly all of the more advanced ones are. What that means is that they can wirelessly communicate with one another. So wirelessly, they can talk to one another and adjust, they can synchronize the way they work, which is a really nice thing. It also means they can talk to other things. So let's say you've got a remote control. You have a remote control for your TV. Well, in the same way, you can have a remote control for your hearing aid. So you may not want to have any controls on the hearing aid, especially if it's small, but with a remote control, you can turn your hearing aid up and down and change the program on it according to your preferences and where you are. Now, this is a very good thing. You may think, well, do we really want to do that? I'd rather the hearing aid did it all automatically. And for some people, it is good if it happens automatically, because then you don't have to worry about whether you can feel it or see it or whatever. However, some people are techies and they like to be able to adjust things manually as well. And this enables you to manually override what the hearing aid is doing automatically. The other thing is, nowadays, the high-end hearing aids are what we call smart hearing aids. So they can actually learn things. So if you've got a remote control and you're making an adjustment, and you make that adjustment several times in the same conditions, so every time you go on the subway, it's too noisy, you turn it down. The hearing aid will remember that you did that. So in other words, you're training your hearing aid to learn your preferences. So instead of having to come back to me to say, oh, every time I go on the subway it's too noisy, can you hook it up to the computer and turn it down? You can do it with your remote, you can train it. So that's another nice option. But if you can communicate with a wireless remote control, you can communicate with other wireless things. And in fact, the remote control I was telling you about has become a wireless hub. So you wear this thing around your neck, it acts like a remote control. It also acts as a hub that communicates between the hearing aids in your ear and your cell phone, if it has Bluetooth. So this hub is a Bluetooth connector. Anything with Bluetooth, it could be your cell phone, it could be a computer, it could be a telephone, a TV, whatever. So this is very nice for people with cell phones because it means you hear your phone in your hearing aids. And I'll never forget when this first came out, I fitted them to a friend of mine. She was in her 70s. She was driving home afterwards and her phone rang. She could hear it in her hearing aids. She thought, oh, I left my phone in my purse on the back seat. However, she didn't have to get her phone out of her purse because all she had to do was tap her Bluetooth hub and answer the phone. And she was hearing the person in her hearing aids, and she just thought this was the best thing. And especially now you have to have hands-free phones in the car. It's a really good thing to have. So this hub can connect you to other things as well, though. So here's the hub, here's the person wearing it. She's answering her phone. Here is a person watching TV. I can plug a wireless transmitter into the back of the TV, and it will transmit to this little hub into your hearing aids. So you hear the TV in your hearing aids. This is wonderful because TV listening is still a problem for a lot of people, even with hearing aids, because the TV sound quality isn't that great and you're not that close to the TV. This changes all that. Because instead of hearing it through the TV speaker, you're hearing it through your hearing aids. And it doesn't matter how close you are because it's like having the TV in your ear. Another thing, and this is the most recent thing, is the microphone. The person who borrowed the system today, is she still here? The person wearing the FM system? Oh, she left. Okay, took it off. Okay. That's an FM system, and I am wirelessly transmitting to that FM system from this microphone. Now they've made all this much, much smaller, so that you don't have to buy an expensive FM system like that. As long as you don't want to hear over too great a distance, you can have a little microphone that the person can be wearing on her lapel, like I'm wearing here, and it's transmitting to this hub into the hearing aids. So this is your third ear. If you're in the car with your husband and you're having trouble hearing and he can't turn to talk to you because he's looking at the road, then if he wears that, it's like his voice is in your hearing aids. You're going to hear him over the noise of the road and the car and everything. If you're in a restaurant with your daughter and she wears that, you're going to hear her voice over the other voices. So it's fabulous for one-on-one hearing. Now, if you're in a meeting or you're playing bridge, you can put that in the middle of the table. It's not going to be as good because it's further away from the voice and it's picking up all the voices. So this thing is going to work most effectively when it's close to the speaker's mouth. Okay, cochlear implants. I'm realizing how I'm going terribly over time. Is it all right if I keep going? Sorry. Okay. Cochlear implants, I told you about earlier, it's like an artificial inner ear. So the thing on the outside looks like a hearing aid, but it's actually attached to your head with a magnet, and inside you have this electrode that goes into the inner ear. That's how that works. They've become amazingly sophisticated. When they first came out, they were pretty simple electrodes, so you could be aware of sound. But nowadays, they've got multiple electrode systems that really can help you to understand speech. And whereas it used to be a priority to fit them to babies that were born deaf and children, nowadays the candidacy has really, really expanded. I have a patient who has a cochlear implant. Guess how old she was when she got it? 93. Isn't that amazing? And she also has macular degeneration. So she was blind and virtually deaf. And she had no desire to go on living. And so when she was given the chance of a cochlear implant, she jumped at it. And I was so impressed that her surgeon did that. I went to see him and I said, isn't that amazing? Because it must have been, it's covered by OHIP, so I thought it must have been hard for him to justify spending OHIP dollars on a 93-year-old, you know? But he said, you know, she had no quality of life. She was blind. At least I could give her something that would improve her quality of life. And she is just the best advocate for this surgery because she says, you know, now at least I can communicate through hearing. Now, obviously, it didn't give her 100% hearing, but it gave her enough to drastically improve her quality of life. So don't think that age is a barrier. As long as you're well enough to have the surgery, you know, it's having the anesthetic and the surgery that's the biggest barrier. Okay, so there are some limitations about hearing aids, obviously. They're not perfect. You have to, they make sound louder, but not necessarily clearer, depending on how good your auditory system is and what your auditory processing is like, as we addressed earlier. They're not going to make people slow down, I can promise you that. The only way you can do that is by asking them to slow down. If you're a long way from the speaker, the hearing aid microphone has to be within a certain range to be effective. And they may be difficult to manage for people with physical and cognitive disabilities. And they require maintenance. Glasses don't require maintenance, do they? You just have to clean them now and again. Hearing aids require a battery. So one way or another, you have to have a battery in your hearing aid to get as a power source. And most hearing aids take batteries that you'll buy at from your hearing aid dispensary or the audiologist. You can nowadays get rechargeable hearing aids, which basically means that you're recharging the battery inside it, and you stand the whole hearing aid in a charger, and it will charge the battery overnight, and then you put it in again in the morning. And that's great for people with manual dexterity issues because they don't have to take the battery out and put it in. They just have to open the battery drawer in the morning and close it again, which is a pretty easy thing for most people to do. And I think that in the future, we're going to see a lot of better improvements in terms of rechargeable batteries from manufacturers in future, because really the battery is the huge limitation on hearing aids now. Technology is so sophisticated with all of this wireless stuff, it just sucks the life out of the batteries. So that's kind of become the limitation, really, of how far we can go with this technology, because the batteries are still small. They have to be small to fit into the hearing aids. But the other thing that you have to do is keep the hearing aid free from wax, because if it's plugged with wax, it's like having an earplug in your ear. And we find that often at Baycrest. Just because somebody's wearing a hearing aid doesn't mean it's working. So we have to check to make sure it has a good battery. And a battery tester is an excellent way to check your battery, because you might put a new battery in your hearing aid and it's still not working. How do you know if it's the battery, or the hearing aid's plugged with wax, or the hearing aid's dead for some other reason? So hearing aids are limited. Even with the best technology. Sometimes you hear things like this. And for a lot of people, assistive devices, like the pocket talker that I loaned the lady, are you finding that pocket talker helpful over there? Can you hear me better with it?
Yes, but I've got to keep adjusting all the time.
You're adjusting it, okay. And so a pocket talker like that, as you can see, is certainly a helpful thing, because it's not little like a hearing aid. So for a lot of our older patients, especially patients with dementia, they're going to take the hearing aid out, they're going to lose it, lots of things, they're going to put it in their denture jar by mistake and get it wet, things like that. So we have a loaner stock of other devices at Baycrest that are larger and easier for people to use. They're less easy to lose, they're less affected by wax, easier to clean, they're often a lot less expensive. That pocket talker, for example, is $100 and some, depending on where you buy it. I hear they even have them at Costco now, even cheaper. And it comes with a variety of different headphones and earbuds and different devices you can use it with. And you can see how that would be great for someone who has trouble seeing and being able to manage the fine controls on a hearing aid. This has a very large volume control that's pretty easy to feel, even if you can't see it. And you're not so likely to lose it. And this is just one of many devices that we call personal amplifiers. You can buy them at Radio Shack, The Source, lots of different places have personal amplifiers. You just want to make sure that you get a good quality one, so that the signal is a good quality. Nowadays, and this I'm looking to the future, but it's actually already here, if you have an iPhone or one of the smartphones, they have a good microphone in them. They have a good amplifier in them. You can use them as a personal amplifier. So there are lots of very good ways now to be able to use smartphones. There really are.
Where did you say you could buy the amplifier?
You can buy these any hearing aid place. You should be able to. The Canadian Hearing Society, which is on Spadina Road, and they have an online store. So you could go online to the Canadian Hearing Society, and they have a whole devices store online where you can look at pictures of things and see how much they are, or you can go up to their store. We sell them at Baycrest, so I don't want to say go to the Canadian Hearing Society if you can come to Baycrest and get them there. But certainly the Canadian Hearing Society has an online store, which we don't. I know Mount Sinai Hospital also sells them. I think you'll find that many of the commercial hearing aid chains like Listen Up Canada and all those places should sell them, especially if you ask for them. That's just another wireless system. I was going to just, so at Baycrest, for example, we have this demonstration area so that we can show you these different devices, because it's not just personal amplifiers that we have, but we have things that help for the phone and for the TV, devices that are especially for those things. So think about this. If you know somebody that's reluctant to get a hearing aid, you can say, well, what's your problem? Are you having a problem on the phone? Then why don't you get a phone with some built-in amplification so you can hear better on the phone? We have lots of different phones. That's why we need to know what your degree of hearing loss, because you can get different degrees of amplification. Plus you can get phones that have flashing lights so that you can see that it's ringing if you don't hear that it's ringing very well. They have loud ringing bells. They can be corded. They can be cordless. They have memories that you can program. They have answering machines. They have, for people with dementia or cognitive impairment who can't remember people's phone numbers or know how to look them up, you can have the picture of the person. So they just press the picture of the person that they want to call. So there are lots of different telephone options. The other big problem for people is the TV. And we have lots of different devices for the TV as well. So when you think about devices, it's not just pocket talkers and personal amplifiers, but telephone and TV devices too. And you know what happens? Sometimes when people do get a personal amplifier or a phone or a TV device, they realize how much of a difference it can make if you can hear better. And then they might be willing to try a hearing aid, because all a hearing aid is a general purpose amplification device that you can take with you and use for anything. It's just that sometimes you need extra help with these other devices too. And certainly you can get that nowadays. There's so many different things that we can help with. And this is a lady who's a volunteer at Baycrest, and well, she unfortunately has passed away now, but she was still volunteering in her early hundreds. So I just wanted to talk about visual communication methods that we have now that we never used to have. Cell phones with text messaging. Nobody uses the phone anymore for hearing. They all text. So unfortunately, as we get older, our thumbs get a little bit clumsy and not quite so nimble. But certainly, I would encourage everyone to learn how to text, especially if you have a hearing problem. It's opened up a whole new way of communication for the deaf and hard of hearing. There are faxes. I know several patients that have faxes. We have email, so even if you get a computer and only use it for email, it's a really, really great thing to have. And here's something that I love for people that are hard of hearing, Skype. How many of you use Skype? With Skype, you can see the person, so if you don't hear them well, you can see their face, and it really helps. And for safety, there are lots of devices you can get as well. So if you're hard of hearing and you live at home on your own, you can get a device that hooks up to a lamp and causes the lamp to flash every time the phone rings or the fire alarm goes off, or you can get very loud buzzes. You can even get something that will shake your bed. You can get a little disc. And this is great, actually. One of our secretaries bought it for her husband because she said nothing will wake him up. So she got this vibrating disc phone that she put under his pillow, or it was an alarm clock actually, and so it shook him out of bed in the morning. So that's a very good thing to have. Or it can be a combination of all of those things. There are even hearing aid dogs, and they're not exactly technology, but certainly there are wonderful service dogs nowadays that can be trained to do lots of different things. And hearing ear dogs, I'd love to have time to tell you more about them, but unfortunately I don't. I just wanted you to know that they do exist. And then I want to talk about quickly environmental modifications. I was talking about those ramps that we need in the environment. These things will help you to hear an awful lot better. If you have a quiet environment, it's much easier to have a conversation. So if you're at a family gathering and somebody wants to really have a conversation with you, pull them aside to a quieter area so you can do that. Turn down background noise. Don't have the TV or music playing while you're wanting to have a conversation. Choose a seat in a restaurant that's away from a noisy area, or go at a quieter time before the main dinner rush happens. Reduce reverberation. Rooms with carpeting like this and baffles hanging from the ceiling are fabulous. If you've got a room, like often places of worship are very echoey, and that makes it much harder to hear if there are echoes. Think about where you're sitting. Choose a seat that's good for you, especially if you hear better with one ear than the other, or you have to see the person's face. If you're having trouble hearing, then see if you can get into a better position. Sit in a group in a circle rather than in a line. And make sure the lighting is good so that you can see the person's face. We have a group at Baycrest where we tried several different rooms for this meeting, and we found that the room that had all windows down one side was so much better because the natural lighting meant that everyone could see each other better and we could lip read better. Then there are the exercises that you would do for your hip replacement. There are the conversation therapy. There's the practicing that we can do in groups using these strategies. And these are strategies that you need to be telling your friends and family about, or using if you have a hard of hearing friend or family member. And these are the big ones. The most important thing in terms of optimizing hearing, because of those auditory processing problems we were talking about, speak slowly. Especially if a person is already wearing a hearing aid, you don't need to talk louder. Unfortunately, lots of people with hearing aids tell me people talk louder when they see they're wearing a hearing aid. Not a good thing. Speak at a normal level because the hearing aid is doing the amplification. But speaking slowly will always help. A lot of people, especially in long-term care where they have caregivers, have difficulty hearing people with accents. Generally, if people slow down, they will enunciate more clearly and think more carefully about how they're speaking and what they're saying. So it's a very good thing to say to people, I'm sorry, please speak slowly. Yes?
Well, I mean, you're talking to people that know that, or, you know, they go through it. But how do you get the young people to do exactly what you say?
Okay, great question. How do you get the young people to do that? Well, I think you flatter them. I think if you've got a grandchild that, you know, is rabbiting off on something that they've been doing and you can't possibly keep up with what they're saying, you say, gosh, you know, I'm sure that's so interesting and I'd love to know more about it, but unfortunately, I can't hear that fast. And, you know, what you need to do is just tell people. One of the things we practice in my group at Baycrest is we practice assertiveness. You cannot assume that people know what you need. You can't even assume that they know you're hard of hearing. Unfortunately, most people try to hide it if they're hard of hearing anyway. I encourage my patients to do exactly the opposite. I say, when you meet somebody new, you need to say, hi, I'm so-and-so, and I'm a bit hard of hearing, and it would really help me if you could speak slowly. Then right off the bat, they know what to do. You've given them that information. If they don't do it, it's not because you've kept them in the dark. It's because they're not thinking. Or they'll just forget, so you have to remind them again. I know one of my patients actually has this wonderful badge saying, you know, I don't hear that fast. I know other people that wear things that say, face me, I lip read. It's important not to hide these things. If you hide them, you cannot expect people to communicate with you in a way that you need. You have to educate them. We have to be advocates for ourselves and our own concerns and our own needs. Keep sentences short and simple. That ties into the memory thing as well, you know. If you're struggling to hear what somebody's saying and you missed a word, you're searching in your memory for, oh, I wonder what that might be. You know, you're trying to guess. You're doing that, and they're going on, and you've missed the next bit. So it's hard to keep up. If people keep sentences short and simple with gaps in between, you're much more likely to be able to keep up. If people ask you to repeat things and they still don't get it, then rephrase it. Instead of saying, you know, Mom, do you want a cup of tea? And you said that 3 times from a different room. Then say, would you like a drink? Are you thirsty? You know, what would you like? You can change the way you say things. Because often, if you've said something 2 or 3 times and the person's still not getting it, the anxiety is there, oh, I'm going to miss it again. You know, so it's making it even worse, because anxiety definitely makes your hearing worse. Make sure there's no background noise wherever you can, and one speaker at a time. So if you get together with your family regularly for a dinner, you have to just remind them, one person at a time, because you can't possibly hear if there's 2 people talking at the same time. Your brain can't separate out those 2 voices. Then we have to pay attention to visual cues. Make sure they can see your face, stand in a clear light, keep hands and other objects away from your face, don't chew gum or eat while you're talking. And I'm always doing this, use gestures and body language, because that helps too. Other communication strategies. First one's so helpful. If you don't attract a person's attention before you talk to them, chances are they'll miss the first couple of words, especially if they're reading a book or watching TV or something. I sometimes feel like I'm a marriage counselor because people say, you know, she talks to me while I'm cleaning my teeth or I'm watching TV, and you're going to miss the first couple of words, and so you're going to have to ask to repeat. If you say the person's name first, get their attention, their focus, they're much more likely to hear you. Make sure that provide context is so important. There are lots of studies that show that older people are extremely good at using context. So if you say, Mum, we're talking about Jason's wedding, then automatically you know what you're talking about. You've got a smaller group of things that you're having to guess from, and so context helps enormously. And because older people have more experience with listening and filling in gaps, we get to be very good at it. So a very helpful thing you can do is tell the person the subject, the topic of the conversation, and let them know when it changes. So if you're watching somebody at a family dinner and you can see they're lost, just say we're talking about the football game or whatever. And also, it's not enough to just assume somebody heard. If you're arranging to meet a hard of hearing friend, can't tell you how many times people tell me they've shown up at the wrong place, the wrong time, come to their appointment on the wrong day. Get them to repeat it back to you so you know they've heard the information correctly. And when in doubt, ask the person how you can help them to hear better. I know some patients that carry a little notepad and pencil in their purse with them because sometimes they need people to write down a word that they're really struggling to hear. So ask them, would it be helpful? What can I do to make it easier for you to hear me? Never say never mind, because this is one of the most crushing things people can say. You don't realize it, and you may say, well, it's just not important. It was just small talk. Small talk is important. And if somebody says never mind, it sends a really negative signal. And it makes people just want to give up and go home. So next time you're tempted to do that, when you're tired of repeating, bite your tongue and try to remember not to do that. Okay, so last thing, groups are great ways. Somebody was asking about classes and lip reading. Yes. There are some audiologists that run groups for people with hearing problems, and we do have these groups at Baycrest because we recognize with our elderly patients that hearing aids don't fix all of the problems and they need this help. Some audiologists will have these groups. They're extremely important so that people can get together and not only practice conversation, practice lip reading, but also share communication problems and share solutions. And this isn't a very supportive thing. So it's like a support group. At Baycrest, we have two types of classes. One is for new hearing aid users, and these are the more typical classes. You'll find these also at the Canadian Hearing Society, some of the hospitals, some of the clinics. And when you get a hearing aid at Baycrest, it includes 4 classes. So these 4 classes will go through things like, what to expect from your hearing aids, what other devices you can get, lip reading, speech reading, various different communication strategies. And this is really good to do, to take a family member or a friend with you, because often once they hear all this stuff, they realize, oh yeah, it's not that simple. A hearing aid doesn't fix it all. I have to be careful about how I communicate. So these are very useful classes. And these are the kinds of classes you'll find at most places that combine a little bit of all of the things I've talked about, including lip reading. With my classes, I find, quite a lot of our patients now do have problems with vision as well. So people with vision problems obviously aren't going to benefit from lip reading. So most classes now include all of these different things. We have one more group at Baycrest, which is a unique group as far as I know. It's called the Hard of Hearing Club. It's been going for 13 years, meeting every week. And this is for people seniors who are severely or profoundly hard of hearing and are socially isolated as a result of that. So these people have given up going to other groups. They might have been attending, playing cards. They might have been going to current event groups or or widows groups, whatever, and they've just given up because they can't hear well enough to communicate, to benefit from those groups. So the Hard of Hearing Club was started by a senior who was in exactly that position. Her husband died, he was her ears, and then she was really cut off and isolated. So we started this group, and it's been enormously popular. We actually have a member here in the audience today, I'm very thrilled to say. And this group is a social group as well as an educational group. So it certainly is largely educational. We talk about a lot of hearing issues and a lot of solutions, but also it's so that people can just get together and socially participate in a group. And we have an informal social tea time at the end where people can just chat. Sometimes people get together for lunch ahead of time. It's a way that people can meet people with the same problems and that understand them, and where they can communicate in a place where they're supported. So thank you for hanging in, and I'm so sorry that I went over time. This is my Hard of Hearing Club. This is a 100th birthday party we were having.
Marilyn, thank you so much.
Thank you.
It's really rare that we get, I shouldn't say that, it's not really rare. We get wonderful talks here all the time, but you gave such a wonderful combination of very practical information and updated us on all the latest technology. So there's certainly many answers out there, and we thank you so much for giving them to us.
Thank you. And thank you for staying.
Oh my.
I'll be happy to take questions if you'd like to stay even longer. It's up to you.
You have time for one or two? Are there any questions?
Okay.
Let me just come to you. Oh my goodness, there are 3 questions.
Yeah, no, I'm happy to stay if you can.
Okay, I just want everyone to hear your question.
Okay, I'll talk loud, I think. Oh, okay. I'm in a choir at my synagogue, and we range from 50 years old up to 70. And it's very important that what we hear is what we hear ourselves.
Yes.
Also, we have to connect.
To monitor your voices,
monitor,
yeah.
yeah.
Mm-hmm.
And we didn't talk anything about hearing ourselves. I'm sure that's a problem. I don't know.
That's a good point. Well, I'm sure you know that lots of musicians do wear ear monitors so that they know what they're sounding like. Are you concerned about not hearing yourself adequately because of a hearing problem?
No, I'm concerned about when you give a sound out, do you hear yourself? I'm sure part of hearing is
yes,
through your head.
Absolutely. When you're normally hearing, you hear yourself internally and externally. Yeah. When you're hard of hearing, you hear yourself mostly internally. And you don't hear yourself nearly as well as you do when your hearing is good. So the normal reaction to that is to speak louder. People who are hard of hearing and don't wear hearing aids tend to talk loud. And as soon as you hear yourself better, you bring your voice down because you're monitoring yourself. Same when you're singing. If you're hard of hearing and you're singing, you're not going to realize if you're singing louder than the person next to you or not. So again, a reason to wear a hearing aid, because then you're able to hear yourself more normally in relation to the other people that are singing. However, if you get this occlusion effect that I was talking about, maybe your voice is coming back at you too much and you're singing too softly compared with the other people. So I think the answer is to be able to hear as close to normal as possible so that you're monitoring your voice so that it will fit in with other people's voices around you. So if you're hard of hearing, that would mean wearing some amplification so that you're aware of how loud you are. Yeah, I hope that answered.
Just one quick question. I'm wearing hearing aids now. Mm-hmm. I don't wear them all the time. When we go to, my husband wears them as well. And we always say when we're going out the door, are you wired? Which sounds pretty silly. My question is, I've had these hearing aids about 5 years, and I'm wondering, should I have constant checkups? I realize it doesn't change your hearing, but should you have a checkup every so many years?
Okay, great question. My answer to that is I think everyone should be followed up at least once a year. The reason is we do a hearing test once a year and see if there have been changes. And also it gives us an opportunity to check your hearing aids, because sometimes, you know, they may not be working quite right, or if there has been a change in your hearing, we can plug your hearing aids into the computer and make appropriate adjustments so that we know that it's still appropriate for your hearing loss.